Hello everybody, Dr. Cameron Khavari and Dr. Robert Hedeen here with Trimodus. And we're going to give you a 4-episode segment of the lumbar yard, hence the flannels and the axe. So a lot of people want to know more on how to get rid of pesky low back pain, and we want to deliver you some answers. So here's how it goes. A lot of people have a misconception of wanting to strengthen the low back. But in all honesty, if you have pain, you probably need to relax the low back a little bit and relax those muscles. And what we really need to do is to be able to move into all 3 planes of movement with all the 3 planes while loading it, moving it without pain, and that's what we need to do. So the 3 planes of movement, front to back. So when we bend forward or extend backwards, that's one plane, right? That's one plane, front to back movement. The second plane is when we bend side to side. And so that's one other plane. And then the next one is rotation. So rotation is the 3rd plane of movement. And we have to be able to move in all 3 planes without pain. And a lot of times people think they can just do extensions, do all these low back exercises, but really we need to be able to load and be able to use these ranges without the pain. So what we have to understand is there's good stress and there's bad stress. And when we talk about these things, Dr. Hedeen's going to go through all this disc loading and how the disc is loaded and when the brain gives it pain. But we have to understand is there's good stress. Good stress is good exercise, being able to get in good positioning. But the bad stress is probably being seated all day in bad posture or lifting in poor mechanics. So, Doc, why don't you go over some disc stuff with us and tell us a little more about this lumbar pain?
Yeah, absolutely. So, lifestyle plays a huge role into what our back is doing from like a segmental standpoint, right? Whether you're working out, whether you're at work or you're sitting or standing all day long, it's very important to be mindful of how we are actually loading this disc. If you think of the disc as much like a jelly donut or something, you want to equally load that jelly donut all day long, or do the best you can, right? So if you're sitting at work at a computer desk for 4 to 12 hours a day, here, you're going to load the front side of that jelly donut, right in here. That will kind of push that jelly, that liquid, that fluid towards the back, towards the spine, okay? I'm not saying you have to have a disc bulge by any means for this to happen, but what the brain sees is that when you overload one side of the disc too much, okay, the brain will kind of create neurological expressions down the posterior chain. The posterior chain either be in the back, maybe hip pain, okay, maybe inner thigh pain, maybe calf pain or foot pain. And so you can have all these distal symptoms or these neurological symptoms just from sitting all day long forward. Okay? And the same thing happens in the gym. If you're in the gym and you're exercising that posterior chain too much, maybe you're doing a lot of back extensions, you're trying to have stronger back muscles, that can also cause too much compression on one side of the disc versus the other. And so it's very important to have not only these ranges of motion that Dr. Cam has been talking about, right? And to have good movement through everywhere without restriction, but to also make sure that we're just being mindful of a healthy disc. How much are we loading front and back? And if we have to all get through life, so one exercise that we can all do that will, whether you have back pain or not, whether you have foot pain or not, or hip or knee, whatever it might be, is maybe throughout the day or in the morning or at nighttime, or maybe you're somebody that has pain at night or when you wake up, is to do these what we call press-ups. Okay, so what Dr. Cam is doing is he is just pushing on the other side of the disc. So regardless if he has a disc bulge or back pain or not, okay, we're going to approach this from a directional preference by loading the back side of the disc compared to gravity always bringing us forward throughout the day. All day long, everything's in front of us, much as we don't realize it. So Cam is maybe every hour, every other hour, every 3 hours going to rock out maybe 10 to 20 of these, not using his low back, but using his arms and is basically pressing up, loading the other side of the disc, and neurologically, that kind of does a lot of magic down the rest of the chain. So anything else you'd like to add to that, Doc?
Yeah, I mean, just like he said, like when we load the disc improperly throughout the day, what he's saying is like we don't necessarily the brain's like only give you pain here. You could get pain in your butt and in your hamstring or your calf and foot just by having bad posture or poor lifting mechanics. And so after today, we're going to have 3 more episodes. We're going to talk about different ways to load the spine and give it good stress so you can beat pain quick. Don't forget, like and subscribe below.